all for cancer to be designated as a notifiable disease in India. We all know that there's a growing burden of cancer in the country. Every year, about 1.4 million cases get diagnosed in the cancer, and this in our country, and this number is likely to go up to 1.5 million cases by 2030. The lack of comprehensive cancer data means that we may not fully grasp the true scale of this disease. And unlike other diseases like tuberculosis or COVID, interventions, standardized treatments, and allocate resources efficiently. Why should cancer be a notifiable disease? While you will hear our distinguished speakers talk about it, but to give you a broad level idea, first advantage is that it will enhance the data accuracy and ensure that every case is recorded and overall a realistic picture of the cancer's impact across the country is provided. Second is that it is likely to improve treatment protocols with standardized guidelines that help in delivering consistent and equitable cancer care. And last but not the least, there will be a strengthening of research and policy decisions once a national cancer registry is made. It will also boost funding and enable more personalized treatment approaches. In 2022, it's important to note that a Parliamentary Standing Committee on Health and Family Welfare recommended that cancer be classified as a notifiable disease. Today, while some states in the country have done it, but many states still haven't notified or
members of the media. Recently, in the budget which was passed on Feb 1st, there was a larger impetus and focus on cancer, adding a couple of life-saving drugs into those which can be in the category of customs free, and then setting the mandate to start 200 cancer daycare centers, plus in the next 3 years an initiative to add at every district hospital cancer centers. But all this will not translate to having a paradigm shift in the way cancer is managed unless you first identify the disease, you understand the cause for it, and you also create after notification a registry and do something to reduce the burden of cancer, because you are frankly doing what is called as a fait accompli or a post event, where you actually set up something to keep treating people rather than taking steps to find out ways to reduce the burden of cancer, in some case eradicate it, and in some case to prevent it from vaccination. So one of the things we have taken up, well, there's another discussion we could have on the Made in India indigenous cervical vaccine program, and why shouldn't a larger universe of people who can be vaccinated get vaccinated when there are third world countries, as far as one in Rwanda, which has got a vaccine policy for cervical cancer covering their entire population, and developed countries like France and US, which has a cervical cancer policy. Notifying means that we get to know that India has a single policy when it comes to cancer, rather than leaving it to the interpretation and implementation to the state. Currently it's divided. Some states have a voluntary cancer notifiable status, some of them do not have it notified, and some of them are trying to take steps to get it notified. But if we wait for years together, the ICMR recommendation is a decade old, asking it to be notified. If we just keep waiting for it to happen, when you have the ICMR as a governing body from Bangalore, which has given a recommendation saying what are the benefits of getting cancer notified, and having worked on it, I think it's high time that policymakers and lawmakers in this country take it seriously, because it's the same body that they have constituted to actually understand what is the impact of cancer, what is the underlying reason, the burden of cancer, and such a recommendation being brushed aside saying cancer is not a communicable disease can't be considered as its own folly, because a lot of cancers are communicable. To start with, HIV-led cancers, hepatitis B-led cancers, hepatitis C-led cancers, HPV cancers, EBVs, just to name. And I'm sure my colleagues, both the clinicians who are on this forum, can further talk about the growing burden of these virus-led cancers, whether it's Burkitt's, or whether it's cervical or head and neck or penile, or whether it's lymphomas, or each one of them. So there is cancers which are being also formed in society which are getting alarming increase in the incidence based on the type of communicable cancers that we get to see. That's what.
Welcome here to get the brief of today. Today is the World Cancer Day. Union for International Cancer Control is an international body which is the largest and oldest global organization dedicated to cancer and its eradication there. 4th of February every year has been earmarked to celebrate the World Cancer Day, making it an awareness to the public and to the stakeholders to take charge the whole year what they have progressed to eradicate, control and bring happiness to the cancer patients. The World Cancer Day is an initiative against the cancer where the entire world unites together to fight against the global cancer epidemic. It takes place every year on 4th of February. It encourages cancer prevention, detection and treatment by raising awareness about cancer. It also presses the government around the world to take action against the disease, public awareness, and day long the social media help to build more opportunities to expose and global awareness about the impact of this disease on the government and the public health, thus enhancing the cancer services accessibility, reducing incidence in cancer, mortality, and finally the phase is called as Smile of Cancer Survivors. This primary goal was brought on the remit of United Nations. And today we are here, the Indian Medical Association, which is the largest professional body in the world with 6 lakhs membership and counting. And in Karnataka we have 32 members with 31 districts membership with and in Taluka levels.
14 lakh cancer diagnoses happen in India per year. Of the 14 lakh, the vast majority, there's about 8 lakh people died from cancer. This is one of the highest mortality rates we have compared to the Western world, where a significant portion of the cancers are cured. And the reasons why most of our patients die, we have anecdotal evidences that maybe because they present late, maybe they're not aware of the diagnosis, or maybe the incidence of them is quite high. But these are anecdotal evidences. We don't know for sure because we don't have accurate data. We have independent people trying to make cancer registries. We have some from Karnataka, some from other states, but we don't have a national database. As clinicians, what I know is that maybe gallbladder cancers are more common in North India, stomach cancers are more common in South India. But do we have a policy for that to identify what causes these cancers and at what stage they present? We don't. We know that the best way to reduce cancer burden is to prevent cancer from happening in the first place. So when we start talking about cancer, okay, causes of cancer, infection is one of the most important causes of cancer. And we fail to understand it. We talk about, of course, we talk about tobacco, we talk about alcohol, and they are important causes of cancer. But we fail to understand that infection is also an important cause of cancer. Hepatitis B and C causes liver cancer. At the same time, alcohol also causes liver cancer. Now, unless we have our own accurate database, we're never going to know that if there's an area which has high incidence of liver cancer, is it because of infection or is it because of alcohol? Do we need to increase the taxes on alcohol to reduce the cancer there, or do we need to vaccinate people so that there's reduction in the incidence of hepatitis B and C? So how do we then make a policy when we don't have data? It is impossible to do that. Similarly, when you look at HPV infection, which causes cervical cancer, there is a vaccine that is out there that if utilized, the reduction in incidence of cervical cancer is more than 90%. But we have higher incidence of cervical cancer in the rural population. But it is the urban population women who are taking the vaccine. And there's a big mismatch there. How do we then identify people where the cervical cancer is more endemic and offer them vaccines? See, let us not forget that we live in a resource-constrained environment. It is easy to sit in rooms and talk that we should screen all women for breast cancer, all women for cervical cancer. But it's not going to happen. We don't have the money for it. Okay? So, but can we then screen out that maybe in urban areas, in these pockets, We need to do breast cancer screening, and other areas, cervical cancer is more common, we need to do cervical cancer screening. That is a better utilization of our resources. But how do we identify that when we don't even know what the incidence is in any particular population? And that is why we need cancer to be a notifiable disease, so we can get that information. It is not just about the types of cancers, even the stages in cancers. We talk about that we have higher mortality in breast cancer compared to the breast
Cancer Day. So we are assembled here to spread the awareness about the cancer. You know, the cancer is the leading cause of death in public in India and abroad. Especially it is affecting the pediatric, children also. So it's quite alarming that it's affecting the children also. So in this context, we all should come together, corporate bodies and government and medical practitioners should come together to form a formula so that it will reduce the burden on the cost of the treatment. So the main aim of this awareness campaign, you know, the cancer treatment is very expensive. It may be chemotherapy, it may be radiotherapy, surgery. So since it involves huge burden on the socio-economic status, so it is our main concern is to bring down the cost of the treatment. And next important thing is prevention. We should aim towards the prevention of the cancer occurrence. So we should curtail at the very beginning. We should do the screening of the patients at the primary health centers and at community level, so that early detection is very important. So that will take us towards a long way in curing the cancers. And next important step is policies. The government should formulate a policy so that the corporate and private bodies should cater this treatment at the affordable cost. And lot of research activities should go on. You know, the cancer is the mutation of the cells. There will be normal cells. Whenever there is a mutation, the abnormal cells will grow in the body, that will cause it as a cancer. So we should aim at detecting at early stage and treating this, and so that the cancer progression will be prevented. So that is called the genomic treatment. Genomic therapies are also important.
The society or the humanity. In India, every 1 in 9 people are getting cancer. So, according to the recent survey, they say genetic mutation is caused only 10%, and most of the other 90% factors is environmental factors and lifestyle factors. I myself am a longevity and lifestyle coach. I do a lot of webinars on how to adapt a healthy lifestyle. So when you look at recently, even cancer is also labeled as a lifestyle disease. So if we take precaution, we can, most of the cancers are preventable, and most of the cancers can be cured. So as Sir rightly said, we have to notify, and first we should have that, create the awareness among the people. There is still a social stigma and the fear around the cancer. Many people think that if you get the cancer, they'll die. And there is a lot of emotional, psychological, the financial and the physical burden on the family, on also the patient. So prevention is better than cure. So we can try to adopt a healthy lifestyle, and we can prevent many cancers. So I have done a lot of webinars on this, online webinars and even physical seminars. Even in the IMA, I have done public guest lectures regarding creating awareness to the people about healthy lifestyle. I am the member of Indian Society of Lifestyle Medicine. So I thank Apollo team to taking this great initiative. I am sure this will create a huge impact on the humanity. Thank you so much.